Hi, I'm Dr. Hardesty, a board-certified plastic surgeon practicing here in Riverside, California. What is nasal surgery? Well, I think it's pretty obvious it has to do with the nose. But believe it or not, it is the oldest plastic surgery procedure performed. First done in India. In India, what would happen is that the individuals, if they stole or if they were caught doing something wrong, their punishment was an amputation of the nose. So, the first operation was reconstruction of the nose. Well, it's come a long way since then. So there's two groups of patients that we operate on for nasal surgery. One is reconstructive and one is cosmetic. If you have a larger hump, an ill-defined tip, a hanging columella, that would be cosmetic. Now, through hidden incision, right here at the waist of the separator of the nose called the columella, we make an incision, we lift this up, and we go in through internal incisions. We reduce the hump, we go ahead and take the McDonald's golden arches, that's what gives the shape to the tip, and sculpt them to give a refined tip. If the skin of the nose is thick, we go ahead and defat it. Now, if the nasal bridge is wide, we'll go ahead and make osteotomies and bring that together. If the nasal base is wide, we reduce it with hidden incisions in the crease called Weir wedges. What we want to do is to bring the nose into harmony with the facial features. We want people, when they look at you, not to just look at the nose, but to be drawn to your eyes and then be able to scan the rest of the face. Of interest, when they take psychological studies and you watch people's eyes track, if they find an abnormality, they'll go ahead and focus on it. What they'll do is scan the face, look at the nose, and talk to the eyes. If they find a deformity or something that's abnormal, like a large mole, as they look at the eyes, they go to the mole. They go back and forth. The same thing they'll do with the nose. So we want to make the nose not the focal point of your face, but we want it to blend and to be natural. When we do reconstruction after an accident or cancers, we have different things, flaps and skin grafts. So that's talking about the nose there. Now, what happens when you have a difficult breathing? That's different. That's caused by the septum. That septum separates our nose left and right. It also has turbinates. We have 6 of these. These are for air conditioners. They humidify the nose, or the air coming in, so as it goes into our lungs, it has moisture. If these turbinates get large, they block the airway. If the septum is deviated, it now doesn't allow airflow. You can snore. You have difficulty breathing. That is called a septoplasty. Through those same incisions, and we can do them both at the same time, we can straighten the septums, reduce the size of the turbinates, and make you or allow you to breathe normally. That's called a septoplasty and a turbinate reduction. So, 2 parts again, cosmetic, just for looks, functional is breathing and after cancer surgeries. When we combine them together, it's called a septorhinoplasty. When we do it just for looks, cosmetic rhinoplasty. When we do it for reconstructive rhinoplasty. It is one of the most enjoyable operations that I perform.